Hi, I'm Dr. Nick Weddle with ScoliosisKC. The question today is just asking about the difference between mild, moderate, and severe scoliosis. Generally, the distinction is made with those with regard to curve size. So typically I would say, whereas like scoliosis is typically diagnosed once you reach 10 degrees, that's kind of the medical standard. But again, I've had patients with 8, 9 degree curves. It's still scoliosis, it's just small, so it's semantics. Generally, I view like a mild scoliosis somewhere up to about 15 to 20 degrees in most kind of ages. 20 to about 40 degrees, or roughly around there, is moderate, and then 40 and above would be considered severe. So that's a pretty simple viewpoint, but it really gets more complicated because it matters the age of the patient who has it. So again, if it's a 10 or 11-year-old that has a 20-degree curve, that's very different than if it's a 16 or a 22-year-old who has a 20-degree curve, right? Because again, the younger the kid is likely going to have more progression as they still are pre-puberty and they've got all the growth spurt remaining. So most of those, if not all, are going to progress a substantial amount, especially for younger kids that age. So in each person, each case is different. That's kind of what we're looking at. But largely, I think the numbers have been established because of kind of the medical management, where you become a candidate for hard bracing at around 25 degrees, and you become a surgical candidate at 40 degrees. And those kind of have become like this standard normal, but yet I don't think they matter that much. So we have patients young, we have patients older with big curves, and they're still candidates for a rehab program and doing the correct exercises, and often get really good results. So it's, I sometimes hear patients say, well, once I turn 40 degrees or once I'm there, then I have to have surgery. And it's like, no, now you're at the minimum, you're a candidate for it. But I know even a lot of orthos are not even doing fusion surgery until like 50 to 55 degrees. So there's more factors at play, but that's kind of the standard way most people are looking at kind of the categorization of types of idiopathic scoliosis. So I hope that helps.